joining us today. I'm excited to be here with Dr. Walt Dawson today. A little background: I met him during our initial program, of which we screened a film called Keys, Bags, Names, Words, and Walt was a feature in there along with his dad, and the very incredible journey that he and his mom had, along with his family, with his father. Walt is a health policy researcher and associate professor of neurology at the Oregon Health and Science University and faculty at Portland State University's Institute on Aging. He's also founder and co-director of the Oregon Center of Excellence for Behavioral Health and Aging, and he earned his DPhil, which we'll talk a little bit about DPhil. I honestly want to learn more about that. He earned his DPhil in social policy from Oxford. He's also a senior Atlantic fellow for the Equity in Brain Health, with a research focus on reducing economic burdens of dementia via public policy that supports individuals, family care partners, and public programs. And if I understand correctly, that's a part of the Global Brain Health Institute. Is that correct?
That's right. Yeah.
Great.
Absolutely.
Well, thanks for being here. We're thrilled to have you as part of our Hope in Aging and Dementia series. And we know you do a lot in that world and can certainly help viewers understand so much more. So let's start out by talking about your motivation. It was well documented in the film Keys, Bags, Names, Words, about your journey with your father. So tell us a little bit about that and how that inspired your lifelong dedication to this topic.
Absolutely, and really happy to be with you today, Todd, and to chat about my work and research and advocacy that, as you said, has been a kind of a lifelong dedication. So my father was diagnosed with Alzheimer's disease when I was 8 years old, and of course, he'd been experiencing symptoms before that, but that's when we were kind of received the formal diagnosis. And that experience of being a care partner for my father and kind of going through that journey of needing both to provide support and care, but then also formal care, and ultimately the Medicaid system and what that meant for my family. And I should mention that I was raised in a rural community in Oregon, where there just were not a lot of resources. And this was in the early 1990s, and there also wasn't a kind of much general understanding or awareness, I think, of dementia and Alzheimer's disease broadly, right, in society. And based on kind of that experience and the challenges that we faced, I got really involved with advocacy, and started writing letters by hand to anyone who I thought might be in a position to help in some way. So that was elected officials, the President of the United States, our representatives in Congress, but also movie stars, famous authors, just anybody who I thought might be able to help in some way or draw attention to the needs and challenges that people like my dad and my family were facing. And honestly, it was really a letter to National Public Radio that kind of captured the attention of folks. And I was invited to read my letter that I'd written to National Public Radio on basically it was recorded but read on air. And that was kind of like a flipping the switch, where there was like kind of lots of national attention and media interest in what I was trying to do. And ultimately I was invited to Washington, D.C. to testify before a congressional committee about my family's experiences and the need to really create a better healthcare system in this country that could provide the support that people begin like my father needed. And uh, that experience at a very young age as an advocate and as a care partner really continues to guide the work that I do now today as an adult, as a professional, as a academic researcher and advocate.
It's quite a story, and I encourage everybody, if you have a chance to see the film Keys, Bags, Names, Words, you'll hear a lot more from Walt and the journey that he had. Is very powerful. There's something that came up. Is one of your driving concerns that there's a quote that 50% of people living with dementia in the US may never receive a formal diagnosis. And can you talk about that number in and of itself, what that means relative to downstream consequences?
Yeah, absolutely. And that's right. That is the estimate. Approximately, 50% of all people who are living with dementia never receive that diagnosis. And that's important for a number of reasons, right? And but most importantly, I think is without a diagnosis, folks aren't able to kind of get the care and support that they need, right, in a timely manner. And that has, always been a problem that continues to be a real challenge for individuals, for the individual who's living with dementia, for their families and their care partners. And it's also a real problem for our healthcare system at a more kind of macro level. And exactly. It's those, and that's what you kind of mentioned, those downstream consequences. If someone isn't getting the care and support that they need, there's um, the the uh, burden and potentially and the challenges that families face can lead to caregiver burnout. It can folks may not seek out formal care or support until there's a crisis, and that has all kinds of implications in terms of costs for the healthcare system. It's just a challenge, and it's also something of relevance as disease modifying therapies are becoming potentially available, right? That the what seems to be the case is getting those therapies to individuals at an earlier within the disease course is really essential too. So this is something that I think is just really, really important to, from a research perspective, from a care perspective, and from ultimately a policy perspective. And that's something that I've done some work in trying to address.
Yeah, interesting. So when we look at you touched on the care aspect of it. So caregivers, since that's what My Care Friends is all about, um, in addition to certainly the patients and the loved ones who are going through whatever health challenges, and in this case, dementia related. Um, what are the financial impacts of dementia when we look at that at both a national and international policy?
Yeah, yeah. Yeah, the reality is that the financial impacts of dementia are huge, right? They're at a systems level, right? At a individual and family level. There's, for individuals and families, there's, the direct costs, right? There's, the spending that you have to do on healthcare, on needing care, right? And so forth. And that's really important to think about how we can reduce those costs that families confront. But there's also indirect costs, right? As I would say, and many would say that are a real challenge. And indirect costs might be, you know, the if a care partner having to leave a job or reduce employment to provide care and support for someone. It's the amount of time that is dedicated to providing care and support, right? And that time that's provided, that has a cost, right? So there's like the formal known costs, but there's also all these kind of indirect costs, and together the financial impacts on individuals are huge. And uh, in terms of our healthcare system, right? Like the public programs that provide then pay for the majority of care and support for dementia, Medicare and Medicaid, this is a huge component of those programs costs. So, there's a need to really think about how we can better support people and families. But there's these kind of systems level questions too, that understanding the costs and trying to reduce those costs that's really important.
So that's great that you mentioned Medicare, which leads me to a question. I understand there was a project, perhaps, uh, that was about early screening for dementia. It was a telephone-based cognitive assessment program. Um, is that something that you were involved with, still involved with? Tell us a little bit about that.
Yeah, so received a grant from the Global Brain Health Institute and the Alzheimer's Association to carry out a pilot study to look at how we could carry out telephone-based cognitive assessments with older adults in Portland, Oregon, where I'm based, who were discharged from the emergency department at the hospital system where I work, and we were basically we had a couple different goals. One is to see if would kind of the general public be amenable to a cognitive assessment, uh, and that is important just to in thinking about how do we go about supporting earlier and timely detection and ultimately diagnosis of dementia. Um, and the emergency department was kind of the location where we wanted to do this because it's kind of I would say a community-based setting, right? It's somewhere where folks from all segments of society may pass through, right? So it's a place where it's kind of a novel place to try this out. And um, basically, we were supposed to do this in person during the pandemic, but it got we had to find a different way to do it. But the telephone-based approach was what we decided to do and test, and we had a pretty good enrollment of folks um, that we reached out to, that my team reached out to, and uh, we found that people generally were willing to do that. Uh, who We had probably I'd say about 28%, I think, of all folks that were eligible, and there was a number of reasons of different eligibility criteria, but about 28%. And that sounds low, but actually for a study like this, that's a really, really good number. But this was important because it was testing this out and seeing if this was a location and a population that you could do that with. And um, it seemed to be feasible.
That sounds phenomenal. So how long of a period did that go on?
It was about over the course of 7 months. I think we were actively recruiting and enrolling folks. And we had just a few months ago had a paper published on it, on our results, that I think is, if anyone is interested, I'm happy to share that.
Yeah, where can they find that?
Yeah, it's in the uh, uh, we can share a link, but it's the International Journal of Geriatric Psychiatry. And yeah, happy to pass that on, but that's where it was published.
Yeah, yeah, we'll get that offline and I'll make sure it's up here on the screen. That's
Great.
great. So the Oregon Center of Excellence for Behavioral Health and Aging, it's a long acronym, OCEBHA. Um, do I understand correctly? It's the first state level center in the US with a specific focus on older adults, and what is it about?
Yeah, yeah, and I know the name is long, and the acronym is we it's pronounced OSEBA. That's what we call ourselves. We go by OSEBA, but you're right. It is the first, to our knowledge, the first state level center in the United States with a specific focus on the behavioral health uh, needs of older adults. So not dementia focused, but rather serious mental illness and substance use disorder needs that are also, a real kind of brain health issue, right? Um, and we received funding via the state of Oregon, but it was through Oregon's block grant from SAMHSA, which is kind of a unique approach to establishing kind of a this type of center. The center is based at two universities. It's housed at Portland State University as well as Oregon Health and Science University, and I'm the co-director of the center. But it crosses both universities, and it is unique in its focus, and we have kind of to really support the behavioral health needs of older adults, three focus areas. One being um, workforce development, um, basically ensuring that Oregon has the workforce that it needs to be able to provide for the specific and unique behavioral health needs of older adults. We also have a focus on applied research, as well as policy analysis, and just trying to be a resource around policy that can support the population, and that we're focused on. And yeah, we also have a paper coming out on that as well very shortly. But yeah, we're really proud of the new center, and it's doing great work.
Oh, great. That's exciting. And we'll put the website up there, the OSEBA website. Make sure that's right here so people can see it as well. Let's turn to global initiatives. Something I'm interested to learn about and have the audience viewers learn is, what is brain health diplomacy?
Yeah, it's a good question. And happy to share a little bit about it. So brain health diplomacy is a novel framework that really tries to directly connect diplomacy with neuroscience to really kind of bridge different disciplines as well as geographic boundaries to really support and promote equitable brain health across the globe. And this is a framework that uh, myself and a number of my colleagues have been working on for several years now. But the intent is really to support global brain health, equitable global brain health, and just as a little bit of background, it's all about international collaboration. It's about multidisciplinary kind of collaboration as well, and it's really again focused um, on equitable brain health outcomes. And I think just to kind of frame this a little bit, so there's a number of kind of individual or personal risks to our brain health that exist, right? And I think those are well known, right? And well understood. That's high blood pressure, it's physical inactivity, loneliness, just to name a few of them, right? But this is really about thinking about the macro level risks that exist, and really trying to connect those to those individual risks that to brain health. And that's, I think, those kind of macro level risks really kind of help bring brain health diplomacy into kind of clear focus. And those macro level risks include, war, armed conflicts, rising economic inequality, uh, and importantly, climate change. And since about 2020 or so, my colleagues and we've been kind of actively exploring how we can directly apply the concept of brain health diplomacy. And And I think there's kind of multiple opportunities and ways that it really can. But one kind of direct outcome of that was the development of the Brain Health Diplomats Toolkit. And the idea was that we could provide a tangible resource to particularly early career professionals from multiple backgrounds and disciplines that could kind of provide them with resources so that they could collaborate, so that they could work together to carry out uh, collaborative projects and advocacy to support brain health. Um, and we were able to partner with the Latin American Brain Health Institute, or BrainLat, in Santiago, Chile, to build and test a Brain Health Diplomats toolkit for the Latin American Caribbean region. And that was a partnership that over several months where we designed and developed the toolkit, refined it. It was launched in, I think, July 2022 in three languages: Spanish, Portuguese, and English. And um, I think it's the toolkit, is a great resource that could be, you know, uh, developed and could be used in many different locations around the world. And that's what our intent was, to provide a resource that could be used for folks,
So interesting.
or
So
could be used by folks.
yes.
Yeah.
So help me understand. It, what is brain capital framework? Is that part of what you were just describing, or is that something separate?
It's separate but related. And I appreciate you asking that. That's a great question. So another another kind of uh, I guess body of work that I've been involved with for a number of years now is this concept of brain capital. And uh, it's the idea that the brain is really an asset, right? And uh, it's really that uh, we need to really think about investing and supporting the brain in many different ways, right? But clearly through policy, through kind of our economic systems, through our educational systems, all the different kind of macro level systems that we have as a society, and that it's really a way to support, again, equitable brain health across the world. Um, but it's a separate kind of framework from brain health diplomacy, but something that's equally important.
So interesting. That's really, all of this is fascinating, and I can imagine the viewers feel the same way. It's not something that we hear every day. We don't even see it posted every day if we're looking on social media. Um, you alluded to something earlier about climate and interaction. So there's an intersection, which you were alluding to, between the brain climate intersection. And if I understand correctly, you co-teach the brain infrastructure, something about that. And tell us a little bit more about that.
Yeah, for sure. And there is definitely a real important connection between brain health and climate, right? And so, and yes, this is the course you mentioned is something that's taught for the fellows at the Global Brain Health Institute, for the Atlantic Fellows. And this is something that I co-teach with my good friend and colleague Harris Ayer, who is kind of the brain capital uh, originator, I guess, is a good way to describe it. But I've worked with Harris and others on this work for a while now. But the course, I think, is just something that's been really great for our thinking about how to connect and show that the impacts of climate change are really uh, something that has a huge impact on the brain, right? And that's something that, is something we want to draw attention to, right? And think of, and because ultimately solutions that can support the climate can support our brain health as a at a kind of a population and global level. Um, and yeah, so that's kind of what that's all about, right? Is thinking about what are those connections between and that I think is an important point in all of this work is like there's so many you know different intersecting parts of our lives and our world that um, we're trying to connect those together and show how that is and impacts brain health, impacts our brain.
Wow. So let's connect some other things for folks. Talking about connecting.
Sure.
You've talked a bit about policy and research, and let's tie that to real world impact. So if we're looking at linking early screening to policy impact, can you help illustrate how pilot findings and research can inform Medicare reimbursement models or caregiving support policies or resource planning?
Yeah, for sure. I mean, I think ideally, right, when making policy, right, you need evidence to support the policies that you want to implement, right? And that's something that I believe strongly in is the need for good evidence. And to have the good evidence, you need to carry out research and have the data to support whatever it is that you're trying to achieve, right? And that's I think what clearly drives my work, but I think that's what's really important to so many of the different policy areas, right? So as you mentioned, thinking about screening for cognitive impairment, right? You need that evidence to show that this is something that it can really be helpful to individuals, that can be helpful to families, but also can be very helpful to systems, right? And to the payers that, such as Medicare, right, in the US, right, that funds most healthcare for older adults, right? Um, you need that research to support and show that we need better policies to support family care partners, right? And that's something that is, I think, just is key and essential for all policy.
How does one or all inject equity into policy development?
It's a great question, and there's, I think, different ways to do that, right? But I think something that's important to think about when talking about policies around dementia, right? And for individuals living with dementia and their care partners is when you when we're talking about developing and designing policies and even carrying out the research that would support the design of those policies, you need to include people living with dementia and people and care partners in the entire process. And that's a way to really do that and ensure that the policies are meeting their needs, right? Um, and so starting with research, right? That's including and not only including but developing together, um, working together to design whatever study that is happening, right? That you want to put together, that you're trying to put together. That must include those individuals with lived experience from the very beginning, and they need to be a a partner and a leader in that. And I think that's true of the policies that ultimately are come from any research or any policies generally. Like they need to be designed by folks with lived experience.
Well, suffice it to say, you are a living example of that, where your lived experience certainly can help and has helped shape this type of movement and understanding equity in policy and so much more. We're getting close to wrapping this up, and really appreciate you spending the time with me and with the viewers. If we talk about some actionable steps and takeaways, um, what would you say they are for policymakers? It's better coming from you than it is from me. What would you say that would be?
Well, a couple things. One, I would say what I just talked a little bit about a moment ago, that the design and building of all policies really need to include folks with lived experience, right? And that's to ensure that they are equitable and that they're actually relevant to the needs of the individuals who are impacted by them, right? So that's one thing. Um, Two, I think kind of thinking about um, re redes there needs to be um, I think at a broad level we need to think to redesign and all of our approach to providing care and support in our country. But that's a huge lift, right? And but it's an important goal. And I think again, the design of that redesign has to be built on evidence and good data uh, as well.
Yeah, because as you say, using data to advocate for systemic change, you need that data, and that's with anything. I mean, that's why research is done. You need to
Yep,
substantiate. If it's a new drug development, you need to substantiate that with data so that it can then move through the process.
you're
Um,
absolutely right. Yep.
so for advocacy groups and the general public, talk about there's three things I've noted. One is amplifying the importance of early dementia detection. Two is support inclusive policymaking, which we're talking about here. And then connecting the climate and brain health in public messaging and community efforts. How can people watching you, how can they do that?
Yeah. I mean, I think that's a great question, and I think the simplest message is getting involved with the 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 policy process and the advocacy process, right? Being an advocate, we all have a voice, right? And I think using that voice is this first step, right? And that's the way that whatever it is supporting earlier detection of cognitive impairment, be it, better policy broadly, be it, connecting the impacts of climate change and on brain health, right? All those things. It starts with all of us being advocates uh, and using our voice to be an advocate.
Yeah, there's all different ways we can help elevate the voices of each other. Certainly,
That's right.
social media is a big way these days, but we can actually get involved. We can get involved in organizations. There are plenty of nonprofits out there. People can look to the institutions that you're involved with, the programs that you're involved with, um, because what we've been talking about today, if we just take a look at them, there's early intervention strategies, which we've mentioned a number of times. There's the inclusion of the lived experience, which is so important. That's how we learn. We learn from others, and we need to
Yep.
listen. It's just like when you go to a doctor and the doctor needs to listen to the lived experience of the human being who's sitting across from them. It's so important.
Yep.
Diplomacy and innovation. You can't get around diplomacy. And we need innovation. So we always have to be looking at that. And then the integration of brain health into the broader policy frameworks. And I know that's what you're involved with, and your colleagues are involved with, and many others around the country and around the world are involved with that. So I guess at this point, I'm going to just share some final thoughts. Your vision for the early interventions, the inclusive design, and the interdisciplinary policy tools that can transform dementia care. And I know this is repeating some of what you said, but we just want to bring it back around for folks.
Yeah. Yeah. Well, I think what I would like to see is I I want to see a better healthcare system that really is equitable, that supports folks, that actually supports families and individuals, right? to do that, I think in specifically in talking about dementia, right, it's including individuals with lived experience in the process from the very beginning, from the conceptualization to design to implementation, right? And that is essential. Um, and I think that would that's perhaps the first step, right? That we really need, and that would be my vision, I guess.
That's a wonderful vision, and one that I hope people take to heart in here.
So,
Absolutely. And thank you so much for spending the time with me, with the viewers. I believe there's a lot of very good, excellent information in here, much that people just are not aware of. People are busy. We understand this. So hopefully in this 30 minutes or so that they've watched, they've taken away a lot more information, and they can help amplify voices as well. We will make sure people have the links to the various organizations, the schools that you're involved in. And, we wish you all the best in your future endeavors, and take care and be well.
thank you so much. Yeah, I appreciate it, Todd.